Welcome back to Longevity with a Longhaul. I'm here with Dr. Roger Miller. He is my neuropsych doctor here at the Aviv Clinics here in Longwood. And I'm going to let him take it away and tell you everything about him and what he does here at Aviv.
Thank you, and thanks for having me. So again, I'm Dr. Roger Miller. I'm a clinical psychologist. I head up our neurocognitive team here at Aviv. Came here from Colorado, 30 plus years of experience before coming here. Before coming here, I was mostly worked veteran with traumatic brain injuries, post-traumatic stress disorder, working with chronic pain clients, and a general source of frustration in healthcare in general is we're very good at treating symptoms, and we're not very good at treating the underlying cause of the problem. And that's a big thing that drew me here to Aviv. So I've been here at Aviv since we opened up. I've been here since March of 2020. Again, I direct our neurocognitive team. So my role here is, first of all, evaluating people's cognitive and emotional function. What's going on that's kind of bringing them here, and whether that's long COVID, whether that's aging, stroking, a number of different things, certainly. And we start with a 3-day assessment of function. I'm looking at, my team, we're looking at the emotional and cognitive function. We're looking at brain imaging, blood work, and 3 days of assessment. From my end, we take this information from your cognitive testing and comparing your performance to other individuals your age and education, so we can see, are things where they should be? If not, to what degree? Why not? And then we use the information from that testing. We use the information from your imaging, your MRI, your SPECT scan. We can see what areas of the brain are functioning well, what areas need some work.
Yeah.
And then we develop a care plan from this. And on my end, what I think we'll have people do, the big thing we have them do, is we do have them do cognitive training exercise inside the hyperbaric suite, as you know. I see...
Which was one of my favorite parts.
Well, good. Well, I think of the brain like a muscle. If you don't use muscle, it atrophies. And when the brain's been injured, we often see more of that, mostly atrophy. Anytime I do anything, I lift up my left arm. That's part of my brain that controls that function. Oxygen blood flow just went to that part of the brain. Mm-hmm. But we put you in a hyperoxygenated state, and then we stimulate different functions, okay, which helps direct oxygen, help direct blood stem cell activity to those different areas of the brain. So we have, as you know, lots of different exercises.
Yeah, so he literally just dug right in and gave you a very thorough explanation of what they do here. And I absolutely have loved working with him, because in the beginning, it was very difficult because I was confused and I didn't know what I didn't know. Mm-hmm. And then, like you said, through a series of tests, you were able to evaluate my ability to function, which in my life, I couldn't. Like I said, before I came here to Aviv, someone was always taking care of me. Someone would drive me here. Someone would sit and wait for me here. But a major milestone for me is to get here, be able to create a podcast and talk about all the things that a lot of people with long COVID don't have the answers to, don't know where they can find solutions. And what was it like for you whenever COVID hit? And then how did it change how your practice, or in some ways did it not change just because COVID was the injury, but the treatment that you offer is still the same? You use the same approach once you figure out what the cognitive differences are.
Well, the approach is the same to a degree, and the core of the two hyperbarics is the same. But we learned a lot, obviously, about COVID and its effect on the body and the brain over the last few years. And, COVID has been absolutely fascinating in many ways and terrifying virus in the broad range of effects it has on the body and on the brain, and everything from cardiac function and inflammation, and sleep and pain and cognitive function. And we see a pair of deficits, or pattern of decreased function in the brain.
With that pattern, so when I came in, it was difficult for me to see, it was difficult for me to speak, it was difficult for me to walk. It was how much, because I lost all of those neurological connections, how much more of what was my brain doing? Like, how much more of a workload was that? What was going on in my brain?
So one thing I noticed in your testing was your information processing speed was below what we would expect that to be. And you certainly noticed that. And if the brain's processing information slowly, it's going to take us longer to figure things out. Everything just becomes more arduous, more difficult. A lot of people with COVID talk about brain fog. And you're kind of going through, it's like you're going through quicksand. It's just hard to sludge through anything, to think things through, to be able to communicate, to be able to process. And so we certainly saw that effect.
And I would feel like I was lost a lot and in my own home. And people would have a hard time believing me, like, how can you get lost in your own home? Like, how would you explain that, like, to someone else who isn't experiencing it?
Well, if you think of, the brain is actually an extraordinarily complex organism, okay? And those connections to understand something, understand where something is, okay? You've got to create this mental picture, and then you create this little map of where that is in relation to you. And one thing we saw with you, one thing we see with individuals with COVID is the metabolic function of their brain has decreased. There's less blood flow. And so because it takes longer to, for that blood flow to get from point A to point B, because that function is less, okay, it's taking you longer to figure those things out. That little map doesn't come about as easily, okay, to be able to
know where to go and how to get there.
Right, exactly. It's just, it's in there. And, something that you take for granted at one point in your life, and then also it's just so hard.
It's just gone.
To access. It can be an incredibly terrifying thing.
Yeah, I was afraid. Like, I was so afraid. And then when I would go to talk to somebody about what I was experiencing, and nobody would believe me, and everybody thought I was trying to be difficult, or people thought I wanted attention, I was like, oh man, I could think of a million other things I could do for attention. And how would you explain to someone who's struggling with long COVID and they're dealing with people who are familiar to them, and how do they learn to find someone that actually believes them and trusts them? Like that's like, what do you tell them? Like, to me, it's like, I felt like it was my fault. I felt like something was wrong with me, and I felt very much alone. And then how do you help people who deal, like, I had anxiety, I had depression, and all of these are symptoms of a bigger metabolic issue.
Exactly.
Right?
Exactly. Well, and that anxiety and depression is, not only anxious and depressed because it's terrifying to lose this function and it's depressing, but neurologically, keep in mind that anxiety and depression, well, where does that come from? That comes from the brain. And I've yet to see a single individual with long COVID that doesn't have at least some degree, and sometimes very significantly, particularly with anxiety. And it does change that physiology of the brain. And with any illness or condition that is particularly something that is fairly new or not understood well, yes, initially, especially, there is that sense of isolation, that sense of, people don't believe me, people think it's all in my head, that people think I'm crazy, whatever. And it can be a very lonely place to be. Fortunately, we are learning more. People are getting more educated. The understanding that this is a very real phenomenon is out there more and more. There's a lot more support out there, at least in the online world, for people that get. I cannot tell you how many people who have come to here that felt like you, that felt very alone, felt very, people don't believe, and we can show on your brain. No, this is actually what's happening. Right. You have objective data to back up those feelings, those experiences, those difficulties that you are having. That in and of itself goes a long way to decreasing some of that sense of alone and of is, what's wrong with me? It's validated.
Yeah. And just having the validation, sometimes me just talking to someone gives them the hope that they needed, that they can and they will get better. So when I came in here, I had just finished my treatment at Mayo, and I had already begun to disassociate myself from my symptoms with the sexual sensitization treatment. And you guys honored that. Like, I asked y'all not to talk about my pain, not to talk about my symptoms, but more or less just like check in with me and ask me what my goals are for the day and what my plans were moving forward. And you guys, like, immediately, I didn't have to really explain it to you, and you got it like right off the bat. Why was that so simple for you guys?
Well, I mean, I think there's a couple of things. First of all, we have an understanding of the effects of long COVID that I'll say most of the rest of the population out there, including the medical community, doesn't have, because we're treated and we're seeing it. We for the first research studies on the effects of long haul COVID, our sister facility in Israel did. So I think that helps, as we have some understanding of that. I think part of it is also, regardless of why you're coming in here, goes back to our philosophy in that we want to personalize things as much as possible.
Right. I'm not a patient.
Exactly. Well, of course, like part of the family. But you come in and have a request, okay, that is individual to you. Well, we want things to be very individualized, of course. And the better, I also profoundly believe, the more we meet your needs separate from the specific mechanisms of the treatment, but the more we meet your needs, the more attentive we are to those concerns, the more positive the experience is going to be. The more positive the experience is going to be, the more positive you're going to feel. And that also is, of course, going to affect your outcome. The better your overall mental state is.
And so when I got here, you did a complete assessment to see my emotional and my mental capacity and functioning. And then you prescribed like on the pad, like explain that again? Like,
so
I know it's chamber.
Yeah, so we created a care plan based upon your issues, and so on pad, there's a series of cognitive training exercises. The program's Brain HQ is the name of the program, and this is a commercially available and widely respected cognitive training program. It's got more research behind it to show its efficacy in promoting neuroplasticity
combined with the hyperbaric experience.
Exactly.
And it was just like I would play these games that are in the chamber, and then because another element of my care was I was working with a physical therapist, and then I would do my favorite, what was called the witty sense. And you said people love or hate it, and I mean, I loved it, and I'm even thinking about going on it like right now. Like I was like, oh man, I want to see what I could do on that thing. And how do you take us from in the chamber and doing these brain exercises to coordinating with our physical therapy and then putting us on this treadmill where now we're not only physically moving our bodies in a certain direction, but we're reacting because
you also have to be cognitively engaged. So one thing that we see with a lot of individuals, and we really see this a lot with long COVID, is decreased metabolic function, decreased function in the frontal lobes, in our prefrontal cortex. Okay? This can affect our processing, this can affect our attention, our problem solving, our executive function. Okay, so the witty sin training, what happens? We put you on a treadmill. Okay, now we coordinate with physio team because that's outside my realm. Okay, so when you had your initial assessments, okay, and the physio team evaluate you, and we're looking at your cardiac function and your ability to convert oxygen into energy and seeing where your anaerobic thresholds are. Okay, so we get those parameters where we can put you on the treadmill.
Yeah.
And what those ranges are to get you up to that anaerobic threshold. Research shows that when you get you on up that anaerobic threshold, that heart rate's up, and then you're engaging in a cognitive task. Now there's less oxygen available to your brain when you're doing that task because your body's taking oxygen away from your brain to those major muscle groups. So it did make those tasks tough.
Oh, I love it.
It really does.
But I loved like the exercise itself made everything else, so much more. Everything was possible. So it was easier to go into the kitchen and get the bowl, get the cereal, get the milk, and then pour it, eat it, and then put it all in the sink. Like,
well, again, you're talking divided attention. And if I can do a divided attention task, because when I'm exerting myself and I'm doing a cognitive task, I'm dividing my attention. So first of all, when I do that when there's less oxygen,
yeah,
it's easier to do that when there's neural oxygen. But that kind of dual task training is also really good at stimulating the function in our prefrontal cortex, which is one of those areas that gets impacted by COVID and other syndromes. And so,
or just metabolic like disorders. Like
absolutely.
it's like everything's like an aging illness, and it's like the root of what is wrong with us is our metabolic function. And if you improve your metabolic function, and if you literally assign it, if like for me, I went in the chamber, I created stem cells, but then not only did I create them, I directed the traffic and said, I want my brain to work better. I want my body to work better. And I prioritized and made it my goal to decide what I was going to do with these stem cells that you guys helped me create, like in there. And I learned so much about the brain. And I said this to Dr. Milwick's, like both the brain and the immune system can learn really bad habits,
Absolutely.
and once they learn to do something that has a negative impact on your physical well-being and mental well-being, you have to learn to retrain your brain and your body. And you have to decrease that inflammation and then have an organized approach to your recovery. And I've learned so many things about the brain, because when I got COVID, and it was like, if you could breathe, you went home and you did that. And then when I would tell the doctors, it was just like my brain. Because I remember 3 days in my infection, all I could say was my brain and water. Like that was the limit of my capacity to communicate with my husband and my children. And I didn't even realize what I was up against. Experiencing a cytokine. Yeah, I was experiencing a cytokine storm, and I was literally just deteriorating like minute by minute, And what I've learned about the brain is just, and metabolic function, and, chronic fatigue, and all of the things that we experience with our retroviral disease process, because that's what it is. Long COVID is a retroviral disease, rebranded, pick a virus, any virus. This could do it to anybody. Yeah. Yeah. So, but what I learned about the brain and the basal metabolic function, or basal metabolic rate, is 60% of all the energy that we have in the starting of the day goes, like the brain consumes so much of your energy.
So much of your energy, so much of your blood supply, so much of your oxygen. It takes up 2 to 3% of your body mass, but at any moment, it's utilizing 25 to 30% of your available oxygen blood supply. So it's a high need area.
And then even when I first had COVID, or when I was started tracking my sleep and everything on the Whoop, I couldn't sleep. And so how important is sleep to the brain and its recovery? It's like,
it is the key of almost everything. Sleep, without good sleep, particularly stage 3 and stage 4 sleep, or deep sleep, or REM sleep, this affects everything from cognitive function, our ability to remember something. Memory is consolidated when we're in stage 3 and stage 4 sleep. Without that, it actually profoundly increases one's risk of dementia. It affects our metabolic function. It affects our immune system. Stable sleep affects pretty much every.
I mean, sleep is like my non-negotiable. Like, it's like I protect it.
Good.
Because that's the only time when I tell people, it's like, that's when your immune system can go through your brain and clean out those little plaques and do the basic housekeeping to like keep all those neurological pathways open to sending and receiving messages, and for, you to, function at a higher level. And I didn't come here and I didn't get better overnight, and a lot of people have a hard time believing I had dementia when I was like 40. And I was just like, I did, and I do, and I still do. And I still have to tell people when I talk to them, listen, I have a little bit of dementia. So if I say something to you twice, just know I forgot that I even told you. Or if I don't remember your name, that's a big thing, is I don't remember people. I struggle with like nouns. And then, but I'm working on it. So like, I'm not accepting that as a diagnosis and a definitive. I'm just saying, this is my weakness, and this is how I'm going to overcome that by not being afraid to tell people, yeah, I struggle a little bit. I talk too much.
Well, and we all have strengths and weaknesses, of course. Illnesses or not. And you're right, we shouldn't get complacent and just accept, well, that's how it is, and there's nothing I can do about it. You mentioned a little while ago about, how bad habits can become very ingrained.
Yeah.
And whether that's our sleep habits, whether that's whatever it is. And certainly we can change that. But yes, it takes repetition, it takes consistency. Anytime we're doing something new, learning something new, and repeating that over and over, you're fostering, you're building those neural connections, you're creating neural pathways, and that can affect us on all function, our physical function, on the logical function. So we do need to be cognizant of the habits that we
create.
engage
All right. And so like who we were before and who we are after our injury are two different people. And so
I can't go backward in time.
you can't go backward in time. But the thing is that I don't think I had really healthy boundaries before. Like, and I always was like a people pleaser and trying to make what seemed impossible possible. And now I feel because I had nothing, you know, I learned the importance of having healthy boundaries around self-care, taking care of myself, prioritizing my sleep, my nutrition, my exercise. Like these are all non-negotiables now because I can't do anything if I don't have that. And for people like after they've had a brain injury, after they like go into like the regular healthcare community, and it's like I don't think it's intentional gaslighting because I feel like people don't know what they don't know. And if and usually if they can't help you, then it hurts you. And it's not, and the thing I like to, remind people that it's not your fault, but in this realm of the kind of treatment that you guys offer here and the multidisciplinary personalized care that people can come in here and just the expertise that all of you have combined and work together to kind of support us. It's like, for me, it's like it's a non-negotiable on treatment if you want to get a jump on your metabolic function to be able to create those new pathways and positive habits, because I literally had to stop the life I was living, and then I had to come here, and part of that routine was exercising, eating right, having consciousness of healthy habits, and then having measurable outcomes, because then I did feel better, and once I felt better I never wanted to feel bad again.
You have to keep those non-negotiables. Some people have struggles with those boundaries, and sometimes people think that they're being selfish by doing something for themselves. And my theory is selfish. It isn't doing for yourself. If nobody else matters, okay, maybe that's selfish. But to give example, I'll give people sometimes is you're on an airplane, and the oxygen mask comes down. You're with children. You first put on your oxygen mask so you can help the other person. If you don't first and foremost take care of yourself, then you can't do anything for anybody else. So those boundaries become critical and lifestyle and self-care. So one thing I appreciate about what we do here is indeed that multidisciplinary approach, that we're trying to address all aspects of your care to give you those tools so that you can pay that forward. You can be okay. And so, yes, and you can go on with the rest of your life and take care of other things and take care of other situations.
Just function at a higher level.
First and foremost, you got to make sure you're okay.
Yeah.
And again, if you're not breathing, ain't nothing going to happen.
Exactly.
So,
yeah. And I think I just can't even. So what would you want long COVID patients to know if they're struggling and they have like a lack of support around them? How would you help them realize that they're the only one that's coming for them? They're the only one that can like help themselves.
First of all, I want them to know that they're not alone. I mean, the number of people we've had come through here this last year with long COVID has been, it is now our second highest frequency of people visiting. It's now long-haul COVID. We're here just a few years ago. This didn't exist. Now all of a sudden it is a major thing. So I want them to know that first of all that they're not alone. I want them to understand that it's not an overnight thing. It's a journey. But if we you have to have a positive outlook. You have to believe that things can be done to help. There are things that do help.
For me, I always say it's trends over time, right?
Yeah.
And so I like use my Whoop to measure all my trends, and I would measure what I would call my fuel efficiency. You know what I mean? I was like, energy is money. If you can't like make it, you can't spend it. And so by improving my fuel efficiency, by prioritizing sleep, nutrition, and exercising, and then healthy relationships, because I really think this is one of the things I don't really talk about a lot, But before, I had created like a toxicity tolerance for people in my life.
Which sucks all your energy out.
Yes. And then when I woke up from COVID, it was just like, just even thinking about that person or being near that person felt like a sunburn. And I don't know what that is, but I couldn't be around certain people, or I couldn't like have those conversations with the people who didn't believe me, because then it just was a cascading effect and would send me into a different spiral. And so people took it personal that I couldn't talk to them anymore. But what they didn't understand was how they were hurting me.
Well, and you have to create your own new normal in many ways. And yes, you can't go backwards in time. And often we have this expectation, well, I used to be able to do this, or I used to be able to feel this way. And the physiology has changed. So you can't say, well, all of a sudden I should be able to do that. So I see a lot of people with lung COVID who have a great deal of sensory overstimulation.
Yes.
The lights, the noises,
Yeah, like when I came in here, I wore glasses, I had hats, I had earbuds in my ears.
Yeah.
And I would tell people, it's like, because I was a nanny for an autistic child, I was like, I felt like I was autistic. And everybody thought I was being dramatic. But I was just like, listen, I'm here. Like literally, my comfort zone is in my bed. My comfort zone is alone at this point. And I was like, you don't see how hard we're trying. And when you see us at our best. You do not see us at our worst. And, but the brain, like, there's so much left to the brain. Like, we only use 20%, right? That they say of our brain. But that's why we have a potential to rewire, re-network, and like find other ways around those different roadblocks. I used to always say I had highways of pain and country roads of comfort. And then with your support, I was able to take those country roads, and over time they became those highways of life for me, and I'm so thankful for where I'm at. But I don't think without the right support and the right people to listen, because I think that was a very important role in your job, is to listen. And I felt like you helped me emotionally. You didn't feel sorry. So I hate two people. I hate people who feel sorry for me and enable me, and I hate the people that deny me, right? But it's that neutrality that I call
acceptance.
Yeah. And you just help me move forward. And I feel like that's what Aviv is about, moving forward. It's like, are you ever going to be what you once were? Well, you kind of don't want to be, right? Who wants to be 2 years old again?
You got to go forward.
Yeah.
You have to go forward. But we also have to believe that we can go forward. I said just yesterday, talking with another COVID patient who's struggling sometimes with, those wants to be what she was, right? And trying to understand that it's going to take some time. I said, you got it every day for those small wins. Yeah, no. And I asked her, she says, okay, so what was one of your wins today? And she was just telling me, it's like, I was listening to a song on the radio called "Don't Stop Believing." And she just kind of hanging on to that. I said, I can, as long as I keep that positive attitude, I can continue to move forward. Yeah, there has to be patience, and we have to have patience with ourselves.
Yeah.
It's as I say, it doesn't change overnight.
And for her, I would just say, like, she's still there. She's actually the one that's driving the bus on these back roads that just really can't find a way. And like, you have to thank her. Like, I would always tell, like, myself, they're like, who do you admire? And I admire the person that I was before, and her strength and her ability. I admire the person who was struggling, who was curious and just wouldn't give up, which that's who she is right now. She's the person who's not going to give up on herself. It's just never going to look the way it did.
No, it won't. But that struggle, I mean, that's how as humans, that's how we grow.
Yeah.
If we're not faced with barriers, if we're not faced with challenges, we never would have ended up at the top of the food chain.
Exactly. Yeah. And then
to be challenged.
And then those challenges actually is how our species evolves.
Absolutely.
I
remember a lady with a brain injury one time telling me she had a lot of struggles initially, and the effects of it, and I wish I was how I was before. But I remember one point, about a year after injury, she said, certainly, it's like, Roger, it's strange. In many ways, his brain injury was the best thing that ever happened to him.
Oh, yeah.
Because it allowed me, first of all, to focus more on actually taking care of myself, those priorities, and it allowed me to see what I could overcome, and I've grown so much more because of it.
And you found your space.
Challenges, we grow through adversity. We absolutely do.
And we don't need other people to believe in us, for us to believe in our symptoms and for us to believe in the processes. And it's like, you'll find your people.
Those people are there. I mean, is everyone going to believe? Of course not. And that's true with all kinds of things.
But I found that, like, usually now I know whenever I came to people with what I was struggling with, it was just like their reaction had more to do with them than it had to do with actually what I was going through. And then I'm just like, oh, so they probably would be that hard on themselves. Oh, they probably wouldn't even believe that they need to take care of themselves. Oh, they probably, so I felt like it's not personal.
Feel some compassion for them.
Yeah. And because before, like, I don't know, it's just the way we were brought up in society and how things have changed. And I really believe during COVID times, good or bad, people's behavior, they were doing what they thought was best at the time. And then now we're at a point where the misinformation can be like dissolved because we have evidence of what is happening to people. And again, it's what I'm experiencing with this retroviral disease is no different from what other people experience with Guillain-Barré or fibromyalgia, or sometimes you don't even know what causes you to have this major shift in your ability to function. You don't know, and you may not know, but the solution is the same.
Oftentimes it is.
Getting back
metabolic function,
getting that oxygen, cellular injury, and then targeting the results. And so I know we're going to wrap up soon. I don't know how much time we have left. We got 2 minutes. Dang, you did good.
Good job. That was good.
Yeah. But if people have more questions, is there a way that they can reach out to you here at Aviv, or like, what would you recommend for people who want to know more?
So first of all, I can always be emailed. It's Roger at Aviv, AVIV-clinics, plural, CLINICS.com. So Roger at AvivClinics.com. Can certainly reach out to me by email. Can call a clinic. I'm happy to answer questions at any time. I have to say, again, my whole career, we're treating symptoms, not underlying cause. So whether it's talking with long COVID or many of the other syndromes that we treat, this has been one of the most astounding things, the most astounding thing I've ever seen in my entire professional career, because we are giving people hope, we're giving people their lives back, and changing what's causing many of these difficulties. And the transformation I see in people's lives every day is just, it's astounding.
Yeah. I just looking in your eyes and being able to see your eyes is a big difference for me.
I tell people I have the most interesting job here. This is the coolest thing ever.
Yeah. And I'm so thankful that you just were really here for me, and that you were just a safe enough place that I could begin to find my way.
No. But in life, you get what you put in. And so I was already be a part of that journey, but it took you to take those steps, to take those risks, and to set those boundaries, and look at where you are here today. It's a different woman.
It's a totally different.
It's astounding.
Mentally, emotionally.
That's awesome.
Thank you. I appreciate it. Thanks again for tuning into Longevity for the Long Haul. I look forward to sharing more stories and more information with you, and I'm sure he'll come back. So if you have any questions about long COVID or topics you'd like to discuss, comment below. Be sure to share this information with anybody you love and you know, so that they can have access to these resources and information. Thanks.